I'm a former Major League Baseball physical therapist that helps injured pitchers get back on the mound. And I want to go over today a common concept and, frankly, a problem that I see in the sports medicine world, specifically treating baseball players, and that is the amount of times that I have a guy come through our door, they've already seen a physician and whatnot, and the physician has just told them, hey, you know what? Don't even bother with PT, just rest for 4 to 6 weeks and then get started back up again. And there's a litany of problems with that more than anything, but I think it is truly a disservice to the athlete when this happens. You also see it after some guy that gets injections. Like, one example that I don't understand is, this is whether it's for athletes or others in the outpatient world, people go and get PRP injections, which, listeners, that's a whole nother topic for another day. But people get PRP injections and they're like, hey, just don't do anything for 4 to 6 weeks, let the injection work. Not in one time in my experience in the professional sport world did I ever not start PT within probably like 3 days out of a PRP injection. Essentially, once the normal injection soreness wore off, we started PT right away. And really, what I'm getting at here more than anything is, when you just shut it down for 4 to 6 weeks, say you have a shoulder or elbow injury, you don't do anything for your arm for those 4 to 6 weeks. Yeah, pain might get a little bit better, but it's primarily because you just removed yourself from the painful stimulus that is throwing. The problem here more than anything that happens is people shut down for 4 to 6 weeks, then they get right back to where they're at, which we're going to talk about a little bit more as well, and their pain's right back to that. And the reason their pain comes right back is because by not doing anything for 4 to 6 weeks, the tissue has become, and the surrounding tissue had become just so incredibly deconditioned, weak, and essentially unstable that now you're in an even worse position to start throwing than when you probably were initially when you had pain with it. So that is why I'm such a big proponent of, the minute you have to shut down from throwing, you have pain, you get started on some type of rehab program. And yes, there's obviously certain things in the beginning you don't want to do that's going to essentially piss off that structure, but you need to be very mindful of, you have to progressively load that tissue in order to prepare it for a return to throwing, especially, again, this is the injured structure. The other side of this is, if you're dealing with an arm injury, there is absolutely no reason you can't work out and train your other arm, your core, and your lower body. And that's for a multitude of reasons, especially from a throwing standpoint. We know that the legs are the biggest force producer from a throwing standpoint. If you're just relying on your arm, you're going to get hurt every time. So it's not only that, but working out your non-injured arm is going to be very helpful for driving positive feedback and strength back into your injured arm over the course of a rehab process. So that is why I just can't express my frustrations enough when people are told, just shut it down, don't do anything for a month or whatnot, and then get right back into it. It's completely unrealistic in setting athletes up for failure more than anything. Yes, there's some timeline components of this, but really rehab is not a timeline. It's a criterion-based projection. You need to make sure you have good cuff strength, normal shoulder range of motion, you're able to tolerate some type of plyometric drill, you're able to load in the gym, and then really, then it's a matter of, okay, then we got to gradually build up your throwing. So that brings us to the next part of this, and that is that when guys just get right back into throwing, they pretty much don't even bother. They were shut down for 6 weeks. They try to get on the mound within a week. You cannot do that. You need to have at least a 1-to-1 ratio, at least if you are at that point. It's probably a little bit longer. So if it's 6 weeks you're shut down, it should probably be no sooner than 6 weeks before you're back in a live BP or game situation. You need to take the time to gradually build up. And I know that's unfortunate. A lot of guys don't want to hear that, but that is truthfully the best way to build up that tissue tolerance. If you do not do that, you are likely going to spike your volume and intensity at some point, and that injury is going to happen again. So these are a lot of factors that go into, when we're working with throwers, how we go about getting them back, not only from the minute they get injured and shut down, but how we build them back up to get to throwing, and then how we progress their throwing, and how we have to continue rehab as they go through their throwing. So again, if you're in this process right now, you have questions, you're not sure about how really to move forward, drop your questions below in the comments section and subscribe to our channel for content like this specific to baseball players.